Hello, everyone. It is 1 p.m. EST, so we are going to go ahead and get started. Thank you for coming to Supporting Community Mental Health in Libraries, a NNLM Region 1 series webinar. This webinar is eligible for MLA Continued Education Credit and Consumer Health Information Specialization Level 1. The evaluation link will be with the enrollment code will be shared at the end of today's webinar. And before we introduce our speakers, we would like to introduce NLM, the network of the National Library of Medicine, and what we do. So the network of the National Library of Medicine is an outreach program under the National Library of Medicine, the world's largest biomedical library and one of the institutes of the NIH, the National Institutes of Health. NNLM has 7 regional medical libraries, and we at Region 1 are based at the University of Maryland, Baltimore. Region 1 serves Maryland, Virginia, Delaware, Pennsylvania, New Jersey, Kentucky, West Virginia, North Carolina, and the District of Columbia. And these are the other NNLM regions. For those of you who are coming from Central Texas today, your regional medical library would be in Region 3. NNLM provides funding for health information outreach, digital equity, and data services projects, provides free webinars and classes, and provides access to a network of libraries and other organizations. The objectives for today's webinar is participants will be able to identify key components of the Libraries for Health pilot, identify the key components of supporting community mental health in libraries toolkit, and evaluate implementation strategies for supporting community mental health in their own library communities. Now, for our speakers, we have some really special ones today. We have Ms. Ebona Sante, who is a Senior Program Officer at St. David's Foundation, a leading regional funder in Central Texas. She has helped design innovative funding approaches, including the Libraries for Health initiative. We have Dr. Lindsay Ayer, who is a clinical psychologist and senior behavior scientist at RAND, where she conducts research and evaluation on expansion of mental health care access and suicide prevention. Dr. Sandra Smith, a certified reentry peer specialist, and Melinda Hodges, who led the Buda Public Library as a member of the original Libraries of Health pilot. And you can find their full bios on the registration page for this course. If you have any questions for our speakers, please put your questions in the chat box. We are going to have a Q&A with our panel at the end of the presentation. So without further ado, Mrs. Sante, I'm handing it off to you. I think you're still muted. Sorry about that.
You can try unmuting now.
Great. Hello, everyone. My name is Ebona Sante, Senior Program Officer with St. David's Foundation, and it's a pleasure to be with you this afternoon, morning, depending on where you are, to learn more about Libraries for Health initiative, which was done here in Central Texas. And so next slide, please. Next slide, please. Thank you. So the Libraries for Health initiative was created by St. David's Foundation in response to the mental health crisis issues in Central Texas. You can tell from this slide that 1 in 5 adults experience mental health condition each year, and more than 50 plus counties lack a single practicing psychiatrist, and stigma is a barrier in adults seeking mental health and well-being. So the foundation, serving a 5-county area in Central Texas, through data, through conversations, identified mental health as an issue. And so we wanted to do something about it. And so in talking to community members, talking to libraries, talking to the state, we developed the Libraries for Health initiative, which we're going to dig deeper into it. Next slide, please. Okay. So with this slide, the takeaway is that the rural counties in our 5-county area have higher self-reported poor mental health days. It was important for us to design something with the community that spoke to what was important for them and what could work in their respective areas. The next slide also, you all are librarians, so you know all this about what libraries are in terms of the fact that public libraries are trusted and welcoming. They're already a community hub that people come to. Nobody checks your ID going through the door. Can you all still hear me? There was a little interruption.
Yes, we
Okay,
can.
great. Thanks. It's free and accessible. Thanks for the thumbs up. And this initiative, Libraries for Health, looked at expanding the role of libraries. And so we had conversations with libraries. Libraries were put in the driver's seat to think about how the Libraries for Health could come to life. We asked them what were the issues that they were being confronted with, and they talked about not having the capacity and the skill set to address patrons experiencing mental health or mental well-being issues. And so they gave us guidance on how to structure the Libraries for Health initiative using the libraries as a hub and also bringing in peer specialists, which my colleague Lindsay will talk about in a minute. On the next slide, it talks more about the setting of the library. Melinda, when it gets to her point, will talk more about the library setting and how the Libraries for Health program is integrated within existing programs. The next slide is a high-level overview of the Libraries for Health initiative. St. David's Foundation funded it. We are one of the largest health funders here in the US. And this initiative was made possible through unique partnerships with the 10 public libraries, with Via Hope that provided the peer support specialists, and also with RAND. The initiative started in January of 2022, and the pilot officially concluded in summer of 2025. The initiative is still ongoing, but we are not collecting any data. The data that we've collected thus far shows that this initiative works. The target was for adult library patrons in communities with a critical mental health needs and communities that had provider shortages. Lindsay will talk about the tax sharing model, which involved a trained peer specialist being embedded within the library, talking to adult patrons, and also using the library as a setting to provide mental health programming and addressing some of the stigma issues that I had initially referenced. The next slide is just high level about who St. David's Foundation is. I'm sorry that the slides are not in order. We serve a 5-county area in Central Texas. We have the mission to advance health equity through investment and action. And when I say health equity is how do we remove those barriers that get into the way of communities and individuals reaching their optimal health and well-being. We have been in existence for 30 years and we invest over $100 million in the 5 county areas of Bastrop, Caldwell, Hayes, Williamson, and Travis County. I'm going to talk about our strategic plan, which focuses on 3 goal areas: increasing access to healthcare, removing economic barriers to improve health outcomes, and the third one is around community-driven change. I want us to get into the nitty-gritty of what Libraries for Health is. So I'm going to pass it on to Lindsay, who is going to talk about Libraries for Health.
Thanks, Abhina. Great. Next slide, please. All right. So Libraries for Health, as Abhina mentioned, was designed in partnership with the libraries. So throughout this talk, I want to emphasize that flexibility and adaptability was really important. And the toolkit that you'll be able to access, I think April also put a link in the chat, hopefully reflects that you can take pieces of this and implement them at a pace that works for you if you're interested. But our 3 core components were peer specialists, mental health programming, and then community partnerships ended up being very important. They weren't necessarily planned out from the beginning as a core part of L4H, but they turned out to be really critical. So I'll go into each of these in more detail in the next few slides, starting with peer specialists, please. All right, so peer specialists were the heart of L4H, still are. Peer specialists are people with lived experiences with mental health challenges. In Texas, there's a requirement for certification. There are specific organizations that are approved to train peer specialists. So I want to emphasize that there is not a nationwide system or set of rules for peer specialist certification, and everybody should check with their specific state rules, just like with other sorts of providers. There are a lot of idiosyncrasies. So in Texas, they have this certification program, and the training involves training in active listening and advocacy and resource navigation. In the case of Libraries for Health, there is also some training in how to facilitate groups and other components that were added by Sandra and her team at Via Hope to fit this particular initiative. Importantly, the peer specialists were supervised, so they weren't just trained and then placed in the libraries and let go. They received a lot of really helpful supervision on a weekly basis. And often we found it was really helpful if the peer specialists came from the community they were working in, or even better, if they were already members of the library community. So we had a lot of success with peer specialists who started out as library volunteers and then saw Libraries for Health in action, wanted to be part of it, and applied to be a peer specialist. What do peer specialists do? A lot of things is the answer. Again, this is a place where there's a lot of flexibility. They, in many cases, were providing one-on-one support for our library patrons. That could be through drop-in or office hours. It didn't necessarily have to be a scheduled appointment. Peer specialists are not doing therapy with individuals. It's a different sort of model, and a great fit we found for the libraries. They also led support groups. They led book clubs, wellness workshops. They did a lot of connecting people with resources, often with mental health resources, but also sometimes with other not mental health specific resources, but things that obviously can impact mental health, like food banks or job applications or benefits applications. Um, One really valuable thing that the peer specialists did was to gather and compile lists of community resources to help anybody who came into the library have a place to go to find mental health, different mental health supports in the community, but also other sorts of social services that might be helpful to them. And then a lot of library staff said in our evaluation said how helpful it was to have the peer specialist there for when they themselves were struggling. Um, Sometimes that was as a result of a specific encounter with a patron at the library. Other times it was just because of life is stressful and most of us encounter mental health symptoms at some point in our lives. And then in addition, the peer specialist just would be around in the library, part of the library culture and environment, building trust, participating in programming, being a friendly and welcoming face, familiar to folks who visit the library. Next slide, please. So peer specialists are one example of this task sharing model that Abhina mentioned earlier, which is basically the idea that given we don't have enough supply of licensed mental health, clinical providers to meet all of the need, we need to think about the mental health workforce as expanding beyond those traditional clinicians. And task sharing does that by enabling trained quote unquote lay people to take on some of the mental health work or tasks shared among all the different types of people and providers that can do that kind of work. So, for example, if a community member needs help with their mental health, maybe they're feeling really lonely and depressed, and they're an older person, and they come into the library um, to have a place to go and connect with some other people around. Well, this trained peer specialist can be there. They are trained to recognize signs that somebody might be struggling. They can approach this person, offer support. Maybe the person discloses their mental health symptoms, or maybe they don't. But this peer specialist can be there to say, this is what I'm here for. Here are some of the resources we have in the library. I can help with this or that. And then if the person does disclose that they are struggling, the peer specialist can help them figure out how to get help to address those issues. Sometimes the peer specialist can support them themselves, and the person might not need anything in addition to that. But other times, for example, if the person might need further formal assessment or medication or something, the peer specialist may not be trained to provide or licensed to provide, then the peer specialist can also connect them to additional help. And so here at the bottom, just as a definition of a term we will use throughout the talk, this warm handoff is really critical. And what we mean by that is a direct person-to-person referral to help somebody connect to care. Next slide. All right, so moving on to the second component of Libraries for Health is the mental health programming and activities. As you can see here, these are 4 different categories of types of activities that our libraries ended up trying in Libraries for Health. There's a lot here. There's a lot of different ways that this could look. So the first upper left category is integrating mental health programming into your existing programs. So for example, if you already have a story time at certain times every week in your library. Perhaps during that time, you have something available for parents, some resources available for parents struggling with parenting stress or, problems that you see in a lot of the parents in your community. Perhaps you have a crafting event. Abena showed a picture of one of those earlier, where during that crafting event, there's some mental health themes infused in either the activity itself or the conversation that is being had while people are doing their craft. So those are some examples of integrating into existing programs. On the other hand, on the right, there is also an opportunity for new mental health programming. Now, this would require more resources, making time in the schedule, finding space, staffing. But the idea here would be to develop programming that is specifically focused on mental health that is perhaps not already in place at the library. So some of the things libraries in Libraries for Health did were they would have a mental health themed book club. Some of them started support groups for things like grief or parenting. A couple libraries brought in yoga instructors or mindfulness instructors to run a class at the library. Um, so there's that option. And then staff training and support in the bottom left. Some of the libraries had actually already started doing things like this before L4H, and others recognized the value of it once the program started. But there are programs out there that are relatively inexpensive to implement. A lot of libraries did mental health first aid, which some folks here may have heard of. Assist is a suicide prevention focused training program. And these are examples where staff are trained in the skills to recognize and identify mental health problems or suicide risk in other people and know what to do about it, know how to talk to somebody about it, know how to tell when it's something that is maybe a crisis or an emergency versus something where you could connect someone with additional support or just be a good listener. So it's training existing staff was something people use their grant funds for. And then finally, resources and collections. Some of the libraries use their grants to purchase books or other materials that could be part of the library circulation. Some, for example, developed these wellness kits that patrons could check out that had yoga mats or other sorts of items that could help promote mental health. Again, here, the resource guides, peer specialists played a big role in developing those in a lot of libraries, but those were made available, brochures, things like that, that libraries could put out to provide information related to mental health. Next slide. So I'm going to skip ahead because I want Melinda from Buda. This is her work. So I'm going to skip ahead to slide 24, if that's okay. And you got a sneak peek, so Melinda will return to those slides in a second. But first, I just want to give you a glimpse of what your roadmap could be if you want to think about implementing something similar to Libraries for Health. And again, I recommend looking at the full toolkit for more material on this. I'm just going to give an overview here. So here's a little roadmap that we have in the toolkit. There are 5 essential steps, I guess we would say. I'm not going to cover all of them in detail, but first you want to, before you start implementing L4H, think about what resources you have available now, including space and staffing, your data systems. Do you feel like your community and your staff are ready for this kind of new program? Learning anything new is hard, even if it's a low resource sort of new program. You also want to think about your community's needs, making sure what you're doing with Libraries for Health is matching those needs. Set SMART goals. We'll define that acronym in a little bit if it's not already familiar to you. So goals that you can measure and know how you're doing, making progress towards your goals. Selecting your activities and peer specialists. I'm not going to talk about that as much here today, but there's more about that in the toolkit. And then preparing to launch the program, hopefully in a way that is sustainable. So next slide. So starting at step 1, is your library ready to launch? So here we want to make sure that our staffing and funding are adequate and stable so that you are able to meet your existing obligations before you take on something new like this program. This is probably obvious to a lot of you if you're library directors or other leaders. But we identified 7 different capacity areas that would need to be assessed, or we recommend assessing, and they're listed here on the bottom left. These include that there's a leader who is ready and able to manage something like this, that your staff are ready. You have financial resources if you need them to support the program. Community partnerships, again, are really helpful. Do you have the dedicated space for what you need? And then on the right-hand side, we have this sort of visual that I think helps to show how, again, if you don't feel like you are ready to implement the full Libraries for Health as we did in this pilot, where we had thankfully generous funding from St. David's Foundation, you may not have something like that, but you can still probably begin to work towards that model by taking on bits and pieces of it as you're able. So there are lower resource intensive aspects of the program, like if you do the integration of mental health themes into your existing programs, that's on the lower resource end, versus if you want to hire 1 or more peer specialists, that's going to be more resource intensive. So it's important to think about your capacity. Yeah, go ahead. Next slide. Thanks, Ruby. And then the next 2 steps have to do with knowing your community so that there's a fit with what you want to do and what the community needs are, and then setting goals based on that. So for knowing your community, we have some suggestions for places you could look for data about your community. A lot of communities do a needs assessment that can be really helpful. There are other sources of data that we list here that are public. If you can't access any of that, or it's not really sufficient to get a good idea of what's going on in your community, you can also go out and talk to people, get feedback from the people visiting your library or other community-based organizations about what they're seeing, for example. And then SMART goals, this is an acronym spelled out here for goals that are specific. So you're stating what you want to see and for whom. They should be measurable. What amount of change are you expecting? Over what time period? Is it realistic? Is it achievable? Is it directly addressing the community needs that you've identified? And then what's the timeline, again, for achieving that change? Next slide. Here, we just wanted to share some quotes to sort of break up the slides here, but just wanted to insert some feedback that we got from various library staff and patrons as we were collecting data on the implementation of this pilot. So for example, on the upper left, a library staff member said, "The return has been great because it's opened up a new idea of what the library does in the community, who we serve, and what we're able to offer." And on the right, a library volunteer said, "For me, it's a place to go. So I don't isolate, I don't get depressed, and I have purpose here in my life." A peer specialist said, "I do a lot of one-on-one interviews where I just let people talk to me about their lives and let them vent because a lot of people just need someone to talk to." And then a patron said, I was the one that introduced my sister and my sister-in-law to the peer specialist. And then I saw the changes. It's working. So generally, nearly universal positive perceptions of the program when we talk to people. That's not to say that there weren't challenges. I will emphasize there definitely were bumpy parts in this process, but that's why we put together this toolkit and did the evaluation so that you can learn from our mistakes and hopefully avoid those same potholes. Next slide. So I'm going to talk now about once you've designed the program around those various capacities and needs, you've set your goals, you've figured out which components of L4H you're going to implement. You want to just make sure you have the infrastructure in place for success. And I want to emphasize how helpful it was for libraries to have key partners to engage in this work so that they weren't alone. There are a lot of other organizations that probably share many of your goals or are helping the same exact people with similar issues. And if you work together, there's a force multiplying effect. So if you're going to hire a peer specialist, definitely reach out to some peer support organizations. There are a lot of great ones out there, and Dr. Sandra Smith and Shannon Carr are on this call, and they know that world really well and can refer you to good ones in your area if you'd like help with that. Mental health providers can be obviously really helpful to reach out to let them know what you're doing and see how you can complement each other's work. Academic institutions sometimes can bring evaluation support, sometimes free student interns who are eager to jump in and help with things. Your city and local government can help with championing your program, also helping you think creatively about physical space that you might need to enable some of the programming you want to do, for example, and thinking about budget. Your friends in the library, obviously, fundraising and advocacy, great sources for finding volunteers. And then a peer library cohort. So in Libraries for Health, we were fortunate to have a lot of libraries starting this all at once together and navigating the process together. And they found it to be super helpful to be able to talk to one another and learn from one another. Um, if you can find something like that, even if it's just one other library who's embarking on this or who has already done this, it can be really helpful to have that peer feedback. And then for funding options, we've listed some here that have come up in our conversations through L4H. Obviously, if you have community partners and can work together to apply for grants, that can be really great, can strengthen your grant application. Some states reimburse through Medicaid for specialist work. That has a lot of other hurdles, bureaucratic hurdles, I will say, but it is something to consider. Um, a lot of libraries have worked to put the peer specialist role into their operating budget. Sometimes that requires convincing their city, or depending on their leadership structure to, that's worthwhile. And data can help with that. And then there are all these other ways you can apply for funding. There have been different federal funding programs that are relevant, foundations, in-kind donations. And then, of course, you could think about training your existing staff so that you may have to pay for some training, but not a full additional staff member. Next slide. All right. And so again, just thinking about long-term success, we have this plan, do, study, act cycle on the left that some might be familiar with, where starting at the top and going clockwise, you're thinking about planning. That's this whole toolkit that we've just been going over. And then you implement it and document so that you're studying your outcomes, learning things, and then you change it all based on that information. Or maybe it's going great the first time you implement it, and that would be amazing. And you keep on doing what you're doing and maybe build and augment it. But it's important, we know from research and from our experience through this program, that we are collecting data so we can demonstrate impact. You can show, not just say, but also show through data that what you're doing is helping people and making a difference. Having a program champion, whether it's your library director or somebody else who can help you advocate, ideally someone with decision-making power. Retaining staff, so thinking about how to prevent burnout. That's really helpful for maintaining the program. And then diversifying your funding so you're not relying on a single funding source in case, as we've experienced recently, sometimes funding sources get really disrupted. And so if you are diversified, you're going to be more resilient. Next slide. So in the toolkit, which you can find using this QR code or the links in the chat, there are worksheets and checklists, tip sheets. We have a lot of examples from L4H. And if you have any questions, you can also contact us, of course, also. But hopefully all of those are helpful hands-on activities. Next slide. So just to summarize, we think that libraries, again, are uniquely well positioned to be this trusted hub that can also deliver mental health support, whether it's proactively, directly, or by providing a culture and resources that support, a mental health culture and lack and decrease stigma. These task sharing models where we're expanding the way we think about mental health support to include peer specialists and other sorts of roles can help us to address mental health in this context where we don't have enough licensed clinicians. And evidence-based programming can be adapted. Again, flexibility is definitely part of this. And hopefully the toolkit will help you figuring out how to adapt it. And again, just thinking creatively about how to partner with others in your community so you can sustain it longer term. Abena and my emails are down here on the slide, and we are both happy to answer questions. I think that's it, right, Ruby? We can turn it to Melinda to talk about Buda.
All right, so if we could go back, I think to slide 20 is where we want to go. That one's good. That's great. I'm going to talk just about our general kind of experience first, and then go into some of these pictures of specific programs that we had. So I think the big thing about this program is that each library truly had to make it their own. We're all together in Central Texas in a 5-county area, but we had very diverse communities. And some libraries decided to focus more on like housing stability, food security, personal safety, because they're out in these areas where there's no one else offering these services. The library is the only resource center that people have access to. My community, Buda, is less rural. We're immediately south of Austin. We're very highly influenced by Austin. So we don't have all the resources that big cities have, but we are close. So our focus was to work on reducing isolation and getting people more connected with each other. We definitely saw after COVID shutdowns, pandemic, that people are having trouble in our community getting connected again. They got used to staying home. They got used to keeping to themselves. And so we wanted to help get people connected again. So we focused on activity-based connections and wellness education, both in terms of physical and mental. And a part of this program that also was super helpful was connecting the different libraries, having this cohort model. Texas doesn't have a good kind of interlibrary communication structure. That was eliminated from the state budget, I don't know, 15 plus years ago. And this cohort model helped us establish these relationships with other libraries that were very similar to us, even if they weren't geographically right next to us. A big thing for our library specifically was to just try things. We weren't exactly sure what our community would respond to, so we just kind of bopped around and tried a lot of different options. We also learned to be very open to partnerships, especially whenever we started releasing press releases on the program, on the grants. We had lots of groups reaching out to us saying, I would like to partner with you on this. I would like to see, could I offer you this class? Some of them were on a pay model, some of them were free. They just came in and we gave them a space to share their expertise with the community. And then once you have a contact, those contacts lead to other contacts. So it's a great model to pursue, seeing what's already in your community and trying to bring them together with your patrons. And different patrons need different models of support. Some just needed the classes to have an impetus to get out of their house or to not be alone during that time. Some people needed more specific assistance or more hands-on assistance. Connecting them with our peer support specialist was really valuable to those people, and then they could have either the support specialists were able to help them on a one-on-one basis, or like we discussed before, make that warm transfer and them to someone that could help them more appropriately. And also the staff training that we had through this program has been very valuable, both in terms of what we've been able to offer our patrons and also staff's comfort with being able to offer these patrons. We come from a lot of different backgrounds, and most of them are not healthcare or mental health related. So being trained, being more educated about what's available in our community and about different ways we can help people was an important part of this process. Sustainability is a challenge for some of us. We're able to keep a lot of the programming going through our community partnerships. Our friends group has done a great job in getting donations for us to help us keep these programs going. But like we said, the full-time peer support specialist, keeping those at the library is going to be a more difficult challenge for us. Some libraries have been able to put them on staff, have them as a full-time member of the staff. Other libraries do not have that option. Like for Buda specifically, we're a municipal department, so our needs for staffing are compared against all the other departments. So like the police department, public works, finance, everybody's, competing for that same limited funding. So the value that this program has brought to our community, I think, has just been so great. And I personally have had a rough go of it lately with like health and family stuff, and just the tools and resources that we've collected through this program has made such a difference just to me personally. And I'm just one person. There are hundreds of people that have gone through our programs. Thousands of people now have access to these resources. So you just you try to measure what a difference this is making in people's lives, but it's just, it's doing good in your community, doing good there for your patrons. I guess if we could go back one slide real quick, I wanted to share about some of the specific programs. We had some big programs that just everybody who wanted to come could come. We had our hobby and volunteer fair, getting together community organizations that either had classes, groups, activities that they wanted the community to know about, or if they had volunteer opportunities. That was a tabling fair in our lobby. So people just came through, worked their way around, talked to who they wanted to talk to. Thrive Together was, it had a wellness fair component with the tabling. It also had a bunch of different classes that the community could choose what they wanted to go to. So there was things like Qigong and yoga and different types of self-care and wellness and mindfulness. So they could just choose which one they wanted to go to. And we ended up having a concert, bringing in some of the musicians in our community that were willing to share about their mental wellness. So if you could go to the next slide, please. There we go. That one's fine too. This just shows some of our, we call them self-care Saturdays. So we have our yoga up on the top and then our sound bath there below. Like I said, we just tried all sorts of different things. Next slide, please. This highlights our peer support specialists. You can see there smiling at you, George and Victoria, and also showing some of the ways that they reached out to the community. We had our one-on-ones where people could make an appointment with them and come talk to them, either talk to them here in the library, by phone, video call. Sometimes they went out in the community and met them somewhere. And then we also had a variety of support groups that we've had. We've tried a couple of different things. The anxiety and depression have been something that's continued pretty much through the whole program, but we've had, as you see here, the chronic illness support, parenting support, cancer support, and just a lot of different things. So that wraps it up for my section. Who's going to give us questions?
Yes, thank you so much. Thank you to all our speakers from St. David's Foundation, from RAND, and from beyond. Thank you so much. We're so lucky to have you. Yeah, if anyone has questions, feel free to put them in the chat box and I will relay them back to our panel. Our first question that I see is how do you manage liability issues? For example, we have staff who refuse to administer Narcan if needed.
Melinda, do you want to talk about that?
I have a little bit on that. We are covered through our city government. If something happens, we know we have both insurance and a legal team available to help us out with that. Um, for Narcan specifically, I can't speak to that.
And
Hi.
the intent of Libraries for Health was not to administer Narcan. It was more around providing the mental health and wellness programming. And Dr. Smith, you want to add anything to it?
Yeah, no, hi everyone. I just wanted to add that Narcan is again a very substance use oriented level of peer specialist and peer support. So it didn't really necessarily fall underneath this scope of this project or anything that would have happened with our libraries. And it's also an individual library question. Like Melinda said, it just depends on the setting. So there's a
I do
whole,
see a follow-up here. How do you convince staff? Um, Pretty much, well, one, they are already working with the public. They already see the need. And if you can give them tools to feel more confident in helping the patrons in this way, I think that goes a long way. Giving them training, giving them, um, resources to turn to. And then a lot of people, if you're in library work, a lot of us already really want to be helping people. So they are naturally inclined to it.
Okay,
I did
so
want, okay, I just
continue.
wanted to go back to what Lindsay said earlier on about peer specialists, what they do, what they don't do, and also just to understand that peer specialists are actually have a level of oversight as far as ethics and standards, and overseen by the Texas Certification Board here in Texas. Most peer specialists, most states, I think we are up to 43 states actually have a version of certified peer specialists, and those are always overseen by their state entity. There are some national organizations, but those are, if you are functioning in their state, have to be trained, certified, and overseen by the state certification board. So it works a little bit different in every state. But again, this pilot was specific to mental health peer specialists. Texas actually has 4 different peer specialists, mental health, family partners, reentry, and substance use as separate. Some just have 1 certification in the state. So just wanted to make that differentiation. And I saw another question over here from an academic, and now it's moved, of course. I'm wondering if you or any of your attendees have heard about similar mental health initiatives in academic libraries. And since we all know that counseling services are a stretch, I don't know of any specific academic setting of this model, but what I can say is that it's a model, right? So when I think of models and replicating models, pilots that have been successful, basically it's available for people to use as they see necessary for wherever they are. So implementing a model different, using the model, but using it for what works in your areas, in your libraries. I think what we were able to do is basically create that. Like, this is how it worked for us. This is what we saw, experienced. The implementation piece is really, really important and crucial. So how you do that, I think having a map, for better words, is always really important, but making it yours would also be really important. So we also are here, as Abin has said, for questions. If someone decides to attempt to implement this, we would be more than happy to provide any input based on what our experience was.
We have another question. Have you seen examples of how online services and mental health programs intersect?
I think Shannon is here. Shannon Carr was also really good with this project, and she actually runs a peer-run organization. So I think it's important to hear just a little bit about what that experience was. I was at Via Hope at the time, and we led the peer specialist training part of this and also helped a little with the implementation. So it's really important to understand all of the different moving pieces and aspects, again, of what we experience, which obviously would be different for yours. Online for peer support in the state of Texas obviously became really important for us once COVID was here and stayed way longer than anybody thought that it would. What had to happen, because in the state of Texas, peer support is a Medicaid reimbursable service, it had to be approved through Medicaid to be able to do online versions of peer support. So when we talk about mental health and we talk about programming itself, it is something that, again, has to be crafted carefully, because we want to make sure that people that are providing those services have been properly trained. So yes, we've seen it, but again, it's not something that should be done without proper training and oversight, if I'm answering that. Yeah.
A lot of the libraries also use their resources to connect people with their online doctors, therapists, offering both technology, a space, and kind of tech help getting them set up to be able to continue that.
And there are actually peer specialist apps, again, that are out there for peer support. I would just double check, as always, with any other service to make sure that they have been vetted properly and that the services that are being provided have proper oversight.
We have time for a few more questions if anyone else has any more.
Yes, Shannon did add a resource for the technology initiatives for peer support in the chat.
I see
Okay.
the AI question. That's, yes, I'm familiar with that. I have feelings about I think the AI integration with mental health, like anything, is complicated. Anything with technology has benefits and potential downsides. I think we're still in such an early stage. We don't know the circumstances under which it's helpful for whom. There's a lot of different products out there, some of which I think have proven to be harmful. So I think it's like proceed with caution is the current approach, similar to what Sandra was just saying about, making sure you're vetting the any kind of digital tools. Same thing with AI. Oh, the question was, are you familiar with AI and mental health integration? Yeah.
I'm sure that's something I know people are actively studying, and we're going to hear a lot about probably, I would say maybe 6 months to a year. Um, but yeah, I know in library with patrons, we're seeing both some benefits of it and then some real concerning things as well.
Yeah.
And I think a lot of it really comes down to qualified information. It's one of those things, as Lindsay said, I have feelings about that. The nature of what peer support is, right? I'm sharing with you based on my lived experience. Is an AI bot, does an AI bot have lived experience in mental health? I would venture to say no. But I think the AI bot would venture to say that they do because they're pulling information from across the World Wide Web. So again, I would just proceed with caution, as with any of the things. Like, would you go to AI, which so many people do, when it comes to medical questions? Would you go to AI for that, or would you want to have an online conversation with a live verified medical doctor with years of experience? So
And
just
also
proceed with caution.
the privacy and confidentiality concerns are another thing that has come up. Especially, I see April is mentioning some of Rand's work on youth and AI chatbots and mental health. And in that group, especially having youth disclose really sensitive personal information, and then it's out there on the web, and it's not protected anymore. So that's another issue. But yes, I see your comment, Diane. You're thinking it might be educating the public about the concerns because people are using it. That's right. Yeah, that's a possible. Melinda, you might have thoughts on that, the role of the library there.
Same as for all the technologies that have come through, since the internet. We have to, even if we don't like it, if it's going to stay, we got to learn how to use it and learn how to use it responsibly and then teach that to our patrons.
Well, if anyone has any more questions, feel free to reach out to our speakers. Thank you again, Melinda, Lindsay, Sandra, and Abhinav for being here. Thank you for rolling with the punches and giving us some great content. For those of you who are seeking continued education credit, we put the evaluation link in the chat box. And thank you so much for coming to this webinar.
Yeah.